Once uncomfortable with that, feel free to exit now and catch the recording later. Thanks. We'll give it one more minute.
All right.
Welcome, everyone. We'll give it just one more minute, 30 seconds more while people are logging on. Grab your lunch. This is a lunch and learn after all. We want to see you eating your meals. All right, Robin, whenever you want to
All
kick
right,
us off.
great. Welcome everyone. And I know Beth's already mentioned, but I wanted to also just remind you that we are recording this session. We love having your cameras on, but if you're not comfortable being recorded, just keep that in mind, okay? I'm going to begin by introducing our Lunch and Learn series. So our Lunch and Learn is an initiative of the Patricia A. Tejan, MD, Teaching Academy. The goal is to promote learning and connection in the larger Nuvance Health community. We feature innovative speakers from within Nuvance Health, and we feature friends of the Academy from across the US and the globe on topics related to medical and clinical education. Our monthly sessions are held every fourth Wednesday at noon, except when they conflict with holidays, which I'll address at the end of the session. We record the sessions and we post them to our website, www.nuvancehealth.org/PATMDTA. So it's our Teaching Academy abbreviation, which is a mouthful. They usually go up within a week. So if you miss it, you can still catch what you missed. And you can also look back at older sessions. So remember, this is a lunch and learn. Eat your lunch. We love to see you eating lunch on camera. If you want to receive CME credit for the session, make sure you go in through EADS. We're going to put the link in the chat, and there's also sign-on information in the flyer on the calendar invitation. I'd like to tell you a bit about our Teaching Academy. We formed last year in 2021. Our purpose was to, and is still, to create a home for a community of interprofessional clinical educators at Nuvance Health. We currently have 17 enrolled scholars in our second cohort for the academic years 2022 to 2023. Applications for our next cohort for the 23-24 academic year will go live in the spring of 2023. So if you're interested in becoming involved, if you know someone who is or someone who should be, let us know and let them know. We hold office hours one day each month at hospital locations, and we'd love to connect with you. Send us an email at teachingacademy@nuvancehealth.org to be connected. I'd now like to introduce Beth West, our director of the Teaching Academy, who will introduce us to our speaker.
Hi, everyone. Thank you so much, Robin. Really just so grateful to and excited to introduce our speaker today, who is Saori Wendy Herman, who holds a Master of Library and Information Sciences and is AHIP certified. Wendy is the director of the Health Sciences Library at the Donald and Barbara Zucker School of Medicine at Hofstra Northwell in Hempstead, New York. Wendy is the operational lead on multiple components of library sciences for the med school and the library's integrated services with Northwell Health. She teaches instructional sessions on literature searches, EndNote, and systematic review methodology to medical and nursing students, faculty, and practitioners. She has experience in conducting evidence synthesis research and is currently conducting an eDelphi study along with two of her colleagues. I also just want to say a special thank you to Wendy. What a wonderful individual for stepping up and agreeing to join us and share her experience and expertise today after our originally scheduled speaker is a little under the weather and unable to be with us today. So without further ado, let's welcome Wendy Herman.
Hi, everyone. Good afternoon. I'm very thrilled to be here. So I'll go ahead and share my screen now so that you can. And if you can just give me a quick thumbs up as to whether you can see my screen and you can hear me, perfect. All right. So thank you so much for joining me today. What I'll be going over is searching and evaluating the medical education literature. I'll be sprinkling in some interprofessional resources as well. I know this is an interprofessional group, so hopefully we'll get a more diverse set of resources that we'll go over. So this is an overview of our session today. I'll be going over the basics of literature searching, what the purpose is, how to get started. I'll be going over the various types of searching as well as searching methods that you can implement, and some medical education literature resources, and also other kind of health related resources that you can search through. And then we'll go on to selecting the appropriate terms, going over natural language terms and control terms. I'll briefly go over study evaluation, and Beth and I actually just attended a journal club yesterday about reporting for medical education studies as well. So I've included resources on that as well. And then the last two is about literature management. So how you can manage the citations that you retrieve from your searches, in addition to how to keep up with literature. And then some references to LibGuides that we've created here at the Zucker School of Medicine, but it's open for review by anyone outside of the institution. So this is just a warm up. So I want to get a general sense of how comfortable everyone feels with searching medical education literature. And you can rate from 1 to 5, 1 being not at all comfortable and 5 being very comfortable. So if you can type in your level of comfort into the chat box, I'll give you a minute to just do that. I apologize, I actually cannot see the chat box, so if you don't mind just reporting out of the...
Sure. Yep, we've got 4, 4, 3, 2, 3, 4, 2, 3, 4. If this was anonymous, I feel like we might get some ones. A couple more 2s. 4, 3, 2, 4.
Okay. So it's ranging from 2 to 4. So for those of you who feel somewhat comfortable or ranging on neutral, hopefully the information that I provide to you today will give you a boost in confidence in terms of searching medical education literature. And for those of you who do feel comfortable, hopefully you'll learn something new that you can implement in your methods. So this is a graph of the research process. And when it comes to searching the literature, conducting that literature review or literature search always comes at the top of your process. There are 3 main purposes for conducting a literature search. One is to gain foundational knowledge. So we're not expected to know everything about everything, even if we're conducting some sort of research on a subject. And so in order for you to get a better sense of what's out there already and to fill any knowledge gaps that you have in terms of foundational knowledge about a particular subject, you want to conduct a literature search to kind of get answers to questions that are more, like I said, something more of a foundational nature. Another purpose is to see if the research project that you're proposing is filling a gap. Is there a gap in the literature? And is the research project that you're proposing filling that gap? And then the third, which is kind of connected, is are you reinventing the wheel? As some of you may know, the process of conducting research or even planning a research project is very, very labor intensive. And the last thing you want to do is recreate the wheel or add something to the literature of which it's already saturated within the literature. So in order for you to figure that out, the best way is to conduct a literature search to see if something similar has been done. If the answer is yes, then this will be a time in which you go back to your research proposal to see if there's a different angle you can take, a different question, or a slight modification to your question to make it a little more innovative. There are 2 main types of searching, one of which is point of care, and this is mainly for those who are practitioners, clinicians who are seeing patients at the bedside, and you need quick information to be utilized immediately at the point of care. Oftentimes this kind of information is secondary or filtered literature, and it's really synthesized and evaluated for you, so you don't have to do it on your end. Examples of such resources are UpToDate, Dynamed, Clinical Key, Visual DX, all these of which you have quick information at your fingertips so that you can quickly apply it to your patient. Now, the type of research that searching that we'll be talking about today is mainly focused on research literature searching. And the research literature searching is a bit more nuanced. It takes more time and it's very much more iterative. When you're searching for research purposes, you're looking for original work or experimental results by the article's authors. You're looking for primary or unfiltered literature that has not been synthesized or evaluated quite yet. And then you're looking for resources in platforms such as PubMed, Scopus, Embase, Web of Science, and the list really goes on and on. You're really looking for that original work of which point of care resources synthesize for you. When you're conducting this type of searching for research purposes, you want to make sure that your steps are very much systematic and transparent. And in the case in which someone wants to recreate the search that you've performed, that you are able to do that and you're able to give, let's say, a search strategy to someone and say, this is what I ran. And if you'd like to rerun it, go ahead, and they should get, very similar results from at the time in which you ran it. So when we're searching literature, I think naturally we're all very used to a very straightforward search, such as if you were to search something quickly on Google, for example, you just kind of type in the question or you type in, words that naturally come out of your head, and it's very unsystematic. You just put something into the search box, click OK. When it comes to research searching, however, you once again have to be very systematic about your processes. You have to be very cognizant about what terms you use, how you're using them, and how each of those terms are related to each other. So in order for you to go through that process systematically, here are a couple of things that you want to really focus on before you even start touching anything. You shouldn't click anything. You shouldn't type anything in. These are the kind of the things that you really should prepare yourself for prior to actually starting doing the search itself. So the first thing is to refine your research question. Your research question is going to be your navigational beacon. I was actually told yesterday at a similar session that I taught about research aims as well. So if you're specifically looking at medical education, research aims may be in place of a research question. However, whether you use research aims or research questions, you need something clearly defined as to what it is that you're trying to accomplish and what it is that you're trying to get answered. Without that, you're going to be swallowed up by literature. PubMed in and of itself has indexed over 30 million articles and counting, and that number grows on a daily basis. So as you can imagine, having this clear-cut research question, set of research aims really provides you a foundation in which you can navigate through the sea of literature without getting that lost. You may get a little lost sometimes, but as long as you have something clearly defined, you have some sort of compass or navigational beacon that you can rely on. The second is to identify which database you want to search. So each database have a set of journals and subject matter in which they index. So each database differs slightly. Things like PubMed, Scopus, Embase, and Web of Science are very much based in sciences, biomedicine, clinical type of content. And so most likely those are the resources that you'll be utilizing. However, there are other databases that have different subject matter that you may want to incorporate, of which I'll mention in a couple slides down. So really identify which database you want to search. If you're ever confused or if you're ever unsure about whether the database you're selecting is really appropriate for your question, always contact a librarian or an information professional. They will always know whether that database is really suitable for the question that you're asking. And the third is to identify the major concepts within your search question. So you have that clearly defined research question. Now you want to pull out all the major concepts out of that question so that you can start making a list of key terms and synonyms for each of those concepts. There may be multiple terms to describe a concept. So you may have multiple words that once again describe a particular concept, but start making that list. One reason for that is you get your thoughts together. And another reason is that each of those databases also interpret words slightly different, just marginally, a little differently, marginally enough where it may make a difference in your search results. So if you realize that a particular term that you're using is not being interpreted correctly, having that list of extra terms and extra synonyms in which you can interchange quickly will really help you run a really efficient search. The fourth item is using the key terms you identified. You have to create a search strategy using Boolean operators. And going back once again, this is really specific for literature searching for research purposes in which you have to be systematic. Having a advanced search strategy is something that would be beneficial in this type of searching. And in order for you to create a search strategy, you take all the terms that you've come up with in step number 3, and then you incorporate things such as Boolean operators, which are and, or, and not, to create this relationship amongst your terms, and also to clearly define to the database how you want the database to search those terms and in what order and in what relation. Finally, you will want to identify limits or filters that you may want to apply. So in some cases, it may not make sense to add a certain term to your search strategy. It may make more sense to filter it out by using these limits and filters that are available to you in various databases. Some of these filters may include language if you only want to limit to English only. It may also include publication date. If there's a particular intervention you're looking at and it was introduced in the early 90s, you know that you want to limit your search to the early 90s as opposed to anything older. So all of these things you want to kind of start thinking of and start writing it down. This could be on a Microsoft Word document or just pen and paper, whatever makes it easier for you. But these are all the things that you really need to consider before you even start your search. So there are methods of searching. And these methods are first, the database searching, which is kind of the classical type of searching. The database searching is merely going to a database and typing in a search strategy, clicking search or go or what have you, and then you'll get a list of citations that are relevant to the terms that you typed in. This is probably the most common type of searching that we're used to and probably the most efficient type of searching. There's also something called hand searching. So in some cases, researchers might want to physically search a particular volume, a particular journal title, a particular issue to see if there are references within the articles that are in that particular issue, for example, that you can add to your library. And so there's more of a manual process in hand searching, but it's sometimes beneficial if you know that there's a target journal that you want to incorporate in your search. Within the database and hand searching, there's a difference between what's called an ancestry search and a descendancy search. An ancestry search is looking at references from articles to see what older material has been referenced in a particular article to see if you can expand your library of citations. So you're looking back to see if there's any seminal articles that you can include and any older articles that are still relevant that you can include. Descendancy searching, however, is the other way around. So you're looking forward to see if there are similar articles that you can that has been indexed. Oftentimes, a lot of databases have a similar article search function or link. So you can use that to see if there's anything that's relevant. And also you can look to see what articles have cited that original article you're reviewing to begin with. So are there any newer articles that have cited this particular article of which you can once again add to the library citations? All of this is kind of based in what's called the snowball technique. Often you may run across an instance in which you were only able to find one or two really relevant articles, and you have you feel stuck, right? And so the snowball technique is really starting small and growing. So similar to creating a snowball, you start small and then you keep building by using things like ancestry and descendancy searching, by utilizing hand searching, and you slowly grow your snowball, in this case your citation library, to a size that to a volume that would be beneficial for your project. So since we're talking about medical education literature specifically, there are challenges to searching medical education literature. One is that there is no comprehensive resource that's dedicated to medical education. There are many resources that include medical education literature. There are also open access resources that are not included in controlled databases. However, they're also available, but there is no one platform that really encompasses all of medical education as its main focus. I kind of briefly touched upon this, but there are a number of open access resources when it comes to medical education that are available that are just simply not incorporated into controlled databases such as PubMed, Scopus, and Embase. That's there's various reasons for that, not because they're of low quality, but it's mainly the way in which those databases index journals. And so there may be open access resources that you're just not getting pulling from these controlled databases. And then medical education research is multifaceted. So it's not like clinical research where it's can positively almost always be found in PubMed, for example. Medical education research in general incorporates concepts of medicine, of education, health sciences, and psychology. And so it's this kind of melange of various disciplines. And so that means that when you're searching for this type of research, you may end up having to look outside of what you're comfortable with, in this case, kind of clinical databases that we're used to. In addition to that, medical education research incorporates various methodologies. So it could be qualitative, it could be quantitative, it could be mixed methods. And so depending on the type of assessment that's being done, it may indicate that this type of research may be found in other resources that aren't typically found in research articles, for example. And I'll go over that in a couple of slides down. I'm going to take a pause right here for a second. I just want to double check if there's any questions or comments in the chat box that I need to address, or if anyone wants to unmute themselves to, if you need me to clarify anything, I'll just take a brief second to pause.
No questions in the chat box, but feel free to unmute, folks.
So I'll go on, but if you do have questions, feel free to unmute yourself or put it into the chat. So these are resources that are available. Some are proprietary, so it's really dependent on what your library has access to. Some are open access, which means that you don't have to pay anything. It's freely available to the general public. The first three resources that I have listed here are PubMed, Scopus, and Embase. They're all what's called controlled databases, and they have what's called controlled vocabulary, which I'll touch upon in a bit. With the exception of PubMed, Scopus and Embase are proprietary, meaning that you need a subscription to access. So if your library has a subscription, that's great. You can access it through your library. All three of these databases do contain research articles, or original research that's been done. And it does have facets of medical education incorporated in their controlled vocabulary and just within the articles that are being displayed in all three databases. Now, with Scopus and Embase, they index more journals than PubMed, and they also index conference abstracts. When it comes to medical education research, a lot of the innovative curricular content sometimes gets presented, or oftentimes gets presented during poster sessions at conferences, talks at conferences, and it may take more time for it to appear as a research article. There's various reasons for that, but a lot of the innovative stuff oftentimes can be found in these conference abstracts. So I highly encourage searchers to look at Scopus or Embase to see what abstracts are out there on medical education, to see if you can grab up anything that's really hasn't been talked about in research articles typically. Another thing with MBASE is that MBASE indexes, I believe, more European literature, of which medical education kind of is not just US centric, but it's within Europe as well. So a lot of things from the Netherlands and the UK and whatnot, MBASE tends to have more European literature, so you might want to take a look at that as well. The next two items are medical education centric, and they're open access, which means that you don't need a subscription to access. They don't have a controlled vocabulary, which means it's just natural language terms. You want to use the simplest search strategy as much as possible. It's similar to kind of like a Google search. And the two resources are called MedEd Portal and then Amy MedEd Publish. Now, I highlight these both mainly because they contain curricular content. Now, how is that different from research articles? Research articles talk about curricular content and oftentimes have a description of what they did, but they don't really provide the nitty-gritty details of how a program was implemented. They often focus on the outcomes or what the perception was of a particular program, but it doesn't really give you a blueprint on how the program was actually run. And what's great about MedEd Portal and MedEd Published is that they provide you with that curricular content that often is missed in research articles. So if you wanted to perhaps duplicate a program that's already been done before, these two resources will provide you with the resources and the materials of which you can pick it up and go. And, of course, there will be modifications based on each institution, but it makes it easy to recreate or reimagine a particular curricular content that was done. MedEd Portal is technically a journal. It is PubMed, it's searchable in PubMed. However, I always encourage people to go to MedEd Portal directly. A lot of the older content isn't on PubMed yet, and also it's just searchability wise, it's sometimes a little easier to go through MedEd Portal directly as opposed to PubMed. When it comes to curricular content, specifically for MedEd Portal, they have this supplemental area in which you can download a zip file. It'll give you all the guidelines and faculty, directions and whatnot that were used for a particular program. And in addition to that, they do also provide a write-up of, a typical, what you would typically see in a research article. So what was the introduction, what methods were used, if there was any assessment, it would also indicate in that write-up as well. Amy MedEd Publish, it contains curricular content in addition to other resources. It's now kind of expanded its scope. I like to highlight MedEd Publish as well because they have this very unique way of peer reviewing. So for those of you who are not so familiar with the peer review process, it's oftentimes blinded, it's behind kind of closed doors, and it's between the reviewer, the editor, and also the authors. But with MedEd Published, they have this format called the post publication peer review. And so what happens is there's some sort of kind of editorial vetting in the beginning. If the submission is within scope, it gets added, and then peer reviewers will review it after it's been added to the platform. And what's really great is that peer review process is very transparent. So you see the reviewers' comments. The authors have the ability to respond back to those reviewers' comments. And so it's a really interesting conversation of why a researcher decided to do what they did based on some of the questions or comments that the peer reviewers provide. So it provides this kind of opens the door into peer reviewing, and it makes it very much transparent. And I feel like those comments can also be things that one could take into consideration if they're re-implementing something or duplicating the curricular content, things to consider when they're bringing that content back to their institution. The next three are not heavily on medical education or medicine in general. The ERIC database is specifically for education literature. Education literature that spans K through 12, higher ed, terminal degree programs such as medicine and law. It really runs the gamut in terms of educational research literature. And what's really interesting is a lot of educational theories you might find in ERIC that may have initially been implemented for the K through 12 level, but can be implemented for adult learners as well. So a lot of resources that are not captured in PubMed, Scopus, or Embase can be captured in ERIC that's very much education centric. We also have, there is also psych info. So psych info is specific to psychology information or psychology literature. This also includes theories, and oftentimes educational theories and psychology theories are based heavily on the kind of psychology component. And so psych info is a really great resource to find those theories if you needed something to really ground your research work. Another thing about psych info is that not only does it have research articles, but it also provides you with articles on instrument validation. So if you're looking for a survey, or if you're looking to find some sort of instrument that has already been validated, then this is a really great resource to go to. Oftentimes with med-ed research, we are looking for instruments that have already been validated so that you don't have to recreate the wheel and you know it's a trustworthy instrument. And so looking through resources such as psych info, or if your institution has availability to cite tests, both those resources are really great to find those instruments so that you don't have to recreate the wheel. Finally, there's CINAHL. CINAHL is specific to nursing literature. So if your research is really based heavily on the nursing population, CINAHL is also a great place to go to, mainly research articles, but once again, it's very nursing centric. And so there are a lot of articles that you may not be able to find anywhere else except for CINAHL. And then finally, we have Google Scholar. The most frequent question I get is it okay to use Google Scholar? And my answer is always yes. It's okay to use Google Scholar. The only caveat is you shouldn't be using it as a standalone. You should always be using it in pairing it with controlled databases such as PubMed, Scopus, and Embase, and what have you. Google Scholar is great in the sense that it will search differently. It uses web crawlers as opposed to some sort of hierarchical ladder in indexing. And because of the way that it searches, it ends up pulling in a lot more results, which is good and bad. One, it's good because it'll look at things that may not be captured in a controlled database, and it will pull in esoteric articles that just haven't been captured yet. It also captures all sorts of content, so it's not just research articles. It'll look at conference abstracts, other gray literature meaning that it's not published in a journal. And so it really casts a wider net. The only problem with Google Scholar is that it does not have a robust filter. So you end up having pages and pages of results, and you have to cut yourself off at some point. In addition to that, it's not as transparent as the controlled databases when it comes to searching. It's very much a black box when it comes to the Google search algorithm. You're not really quite sure if things are being prioritized or if they're not being prioritized, and which browser you use and whatnot. So that's why I always say it's always good to search Google Scholar in tandem with other databases. So this is just a screenshot of the two curricular content databases that I had mentioned. There's MedEd Portal. This is just a screenshot of one of them. This is the appendices or the content material that I was talking about that will download as a zip file. You can just simply click on download and you'll get access to all these rubrics, instructions, outlines, etc. And then this is just a screenshot of the MedEd Publish. And once again, to kind of highlighting the post-publication peer review process and how you can search through. Both of these resources, once again, you want to use the simplest search string as possible. Don't make it complicated with Boolean operators. Just make it kind of single word or just at least double or triple word searches. Now, the good thing about MedEd Publish and MedEd Portal is that it's going under the assumption that you're looking at medical education, which means that you don't have to type in medical education, undergraduate medical education, or anything related to medical education because it's already assumed. So you're really looking at just the content that you were looking at without having to specify which population you're looking for. The other databases, however, you need to specify a little more. So this is just the basics of searching. This is not specific to a particular database or search engine. These are good practices that you should keep in your back pocket. When you are searching any search engine or a database. There are things that are considered, and there are things in which the database will interpret differently depending on how you use them. I'm not going to go through all of them, but I do want to highlight three. One of them is called the usage of quotation marks. When you want to use terms, when you are describing a concept that has multiple words to describe that concept. So for example, literature searching. It describes one concept, but there are actually physically two words within that description. If you want to make sure that those two words are not split apart, meaning that the database will not take literature and searching and indicate that as long as these two terms are somewhere in the record, I will pull it. Instead of, it being next to each other as one concept. If you don't want that to happen, you can encapsulate those terms in a set of quotation marks. This will tell the database, I want you to search this term as a phrase in this exact order. Then it won't break it up for you. It will search it as a phrase. There are caveats to that. Mainly if you're specifically looking in PubMed, there's a background mechanism called automatic term mapping, in which it will associate control vocabulary that exists that matches what you put in and automatically incorporate those into your searches. It will stop that process from happening if you do put them in quotation marks, but that's specifically for PubMed. Parentheses. The parentheses will determine the order of the keyword interpretation. So anything in parentheses will be interpreted first. And it also provides a relationship between all of the words as well. So if you look at the example down here, I have salmonella in hamburgers or eggs, one with and one without the set of parentheses. The first one, the database will take this and say, okay, you are searching for something that has the word salmonella and hamburgers somewhere in the record, or you're searching for something, a record that just has the word eggs in it. The second one, however, although it's the same with the exception of the parentheses being included, the database will now interpret this as being, you're looking for something that has the word salmonella in the record and either hamburgers or eggs. So it has to be matched with salmonella, or the criteria is that it's either one of these and the term salmonella, and then it will pull up the results. Now, as you can imagine, the results will be very different based on just simply the incorporation of parentheses. And then finally, the Boolean operators, we have and, or not that I mentioned. This gives you a description of what these Boolean operators will do. One thing that I oftentimes tell searchers is to not use the not as much as possible. The not is there to exclude things. And unless you really need to use the not, I typically say don't use it, only because you will more than likely going to be excluding things that you don't mean to exclude. So use the not sparingly, only if you really, really need to use it, or you know that using it will not really affect your search strategy in a drastic way. Okay, so another pause. Is there are there any questions so far about that content? Okay. All right, so I'll go on. So selecting the appropriate terms. Appropriate terms come in two varieties. One is called control vocabulary, of which I've kind of touched upon throughout this presentation, and the other are called keywords or natural language terms. Control vocabulary are a list of terms that are selected to describe one concept. It's often used to index or tag records in a database, and in theory, it's supposed to alleviate the need to type in all iterations of a particular term. So let's look at this image, for example. You see an image of the sofa. So it says, what is this? It's not a bed, it's not a chair, it's not a table, it's, and then you have all these words that could potentially describe what this image is. It could be a couch, it could be a sofa, it can be a Davenport, a Chesterfield, a love seat. And so what a control vocabulary does is it will assign one specific term to a concept, in this case, the sofa, And then anything in which the searcher types in, it would always map to that one specific term. So if you were to use the control vocabulary, let's say the control vocabulary in this case is sofa. If you type in sofa as a control vocabulary, then the database knows to consider any content that has either the word sofa in it or any of these other terms in it. And that's how it's kind of functioning in the back end. And that way, once again, in theory, you don't have to type in all these terms into your search box. Now, there is a big but when it comes to control vocabulary. Here are some potential problems. One, it may be too broad or narrow, depending on what the subject matter is. It may not exist. So if you're looking at something that's extremely new or that it's just not really talked about frequently in the literature, then a control vocabulary may not exist. The next is it may not be categorized correctly. So up until recently, a lot of the indexing, although there was kind of an automatic AI component of it, a lot of it was vetted by human beings. And so those who are reviewing and categorizing and indexing will read the article and then select appropriate control vocabulary to tag those articles. And in that process, as you can imagine, the interpretation of one concept, although kind of similar, may differ between each reviewer. So there might be kind of minute differences that may affect the way that your search results come up. And then the last bullet point is really specific to PubMed, but if you're only using control vocabulary, in this case, MESH, which is the short for medical subject headings, it will not capture newly added articles. So there is a slight window in which articles that need to be indexed will not be indexed until a week or two. And so in that window, you may not be capturing the newly added articles that have not been indexed yet if you solely rely on control vocabulary. So what is the solution in this case? The solution is to use combinations of control vocabulary in addition to natural language terms. Now, natural language terms are free text terms that are not controlled. It's things that come out of our mouth, things that we naturally type onto our keyboard, things that come out of our mind, that it's really, there's no hierarchical order, there's no contextual meaning attached to it. And so it's free form. So if you use natural language terms in addition to control vocabulary, you have the ability to capture those newly non-indexed articles, in addition to looking for anything that may not have been indexed correctly or may have been indexed in a way in which it didn't capture it the first time if you were to just solely rely on control vocabulary. I have a reference here for our medical education resources LibGuide. I have it a couple slides down as well, but this is open to anybody. As our resources, unfortunately, are limited to our users. However, if your institution has access to it, there are references to medical education journals that are currently being published, and other kind of medical education research related content that you may find useful. And a lot of the content that I covered here today will either be found here or in a different LibGuide. So I've been talking a lot. So let's kind of walk through this process. I've talked about databases, how you kind of go about this whole process, but until you actually do it yourself, it becomes a little harder. And once you're actually doing it, you get stuck. So this is just a walkthrough of what the process will look like. So we'll go through this walkthrough together. The research topic I've already provided to you. We're looking at distance learning strategies in undergraduate medical education, specifically during COVID-19. So what we want to do first is you want to pull out the major concepts from that research topic. So within the chat box, I would like you to enter in the major concepts that you think are appropriate to pull out in this case. So you can just type that into the chat box. And I apologize, once again, I can't see the chat box, so if you can just.
We've got 3 distance learnings so far.
Distance learning, okay, great.
Anything else? COVID-19?
Yeah.
Undergraduate medical education? Yeah.
Okay. Excellent. Yes, so those are all the three major concepts that you can parse out from this research topic. As you can see, the way that this topic is worded, you essentially pulled out everything with the exception of, kind of connector words like in and during, but that's usually what happens. When you're pulling out the major concepts, I often kind of equate it to pretend like you're Tarzan. Tarzan sometimes does not speak complete sentences. However, we know what he's trying to say, mainly because he's using major concepts when he's communicating. So you want to do the same thing when you're communicating with the database. You want to hone in on the major concepts and then find appropriate terms to describe those major concepts. So let's start with the first concept that was described, distance learning, right? One thing about this particular case is, I guess my question to all of you is, would you include the word strategies if you were to describe that concept? And a simple yes or no in the chat is fine.
Got a couple of no's. And a few head shakes, no, as well.
Okay. Yeah, so those of you who answered no, great job, because I would not use the word strategies in your search strategy in this case. Here's why. When you're describing strategies, some articles may be looking at a specific strategy. It may not actually use the term strategies or strategy in their title, their abstract, or their keywords. They may be pinpointing what exactly they use. So let's say they use osmosis during COVID-19. They may be indicating osmosis as a strategy, but they may not directly say this was the learning strategy we used. So in this case, you'll drop the word strategies, but you will find terms that indicate distance learning. That can include virtual learning, remote learning. I have the next slide will give you more terms. The next concept that you pulled out was the undergraduate medical education. So when you're searching databases, once again, like PubMed, Scopus, and Embase, you really want to come up with the population for medical education. That may not be the case for all type of searches. Sometimes, in fact, if you're, let's say, doing a search that includes social determinants of health or a particular specific population, you may not actually capture all that you want to capture if you were to pinpoint within your search strategy the specific population. But in the case of medical education searching, because there are three tiers, the undergraduate, graduate, and continuing medical education, you really want to specify which tier you're looking at. So you would include terms like undergraduate medical education. Also look at terms like medical school or medical students, something that really describe that population. And then finally, COVID-19 was the final concept. If you're doing any searches on COVID, there's been a lot of research and a lot of time spent on finding search hedges or groups of terms that describe COVID, which are available oftentimes on any of the databases that are there. So the things to do is more of like a walkthrough. When you are doing this on your own, you'll do the same thing when you're, even if the research topic is different, you'll want to make sure you pull out the major concepts, make a list, and then find and create these relationships amongst the terms.
Wendy, I think we had a quick question maybe from
Yeah.
Cynthia. I saw a hand raised. Go ahead, Cynthia.
Oh, it was not a big point, but just one thought I was having was just to remember to use the synonyms of remote learning or distance learning as well too, because there's like a breadth of different terminology that can be used for the same concept. And the other thing is COVID-19 is like anything that happened after April 2020. So it's during COVID-19, you could just use a time-based search to encompass that time period necessarily than using a word-based search. It's just thoughts on that.
Yeah, so I think those are really great strategies. I agree. Using the synonyms, I provided kind of a sample search strategy, but as you can see, things like mobile learning, remote e-learning, distance learning, all those terms you would use to include into your search strategy. And when it comes to COVID-19, I think that if you narrow down your search to the years in which COVID emerged and its continues, so about 2020 onward, I think the likelihood of you coming across distance education in response to COVID is probably, I think, high because of that time limit. But that may not actually be the case for all literature searches, understandably. You know, it just so happens that COVID, there was a distinct kind of year marker in which it was introduced and so forth. But there may be literature that you may pull in that may also be a false positive if you don't include COVID, only because distance learning has been a concept prior to COVID. It just kind of ramped it up during the pandemic era times. But yeah, I think those suggestions of kind of utilizing those filters to find different ways to filter down your search strategy is great. So thank you for your input. This is just a sample search. There is no golden search strategy for anything. It's a very iterative process. You are interchanging terms, you are adding new terms, perhaps removing terms as you go. So once you run a search, you'll get a better sense when you're going through the search strategy of terms that may come up frequently that you hadn't considered initially. So while you're running these searches, you'll be continuously kind of looking out for terms that may potentially be included in your search strategy that you hadn't initially included. This is just a sample search of what the topic that we just talked about. But as you can see, there are a combination of natural language terms, some controlled terms, and this is just an example of what it looks like if you were to use a combination. In addition to that, just pinpointing, the Boolean operator relationship. So if you have a group of terms that describe one concept, you want to make sure there's an OR relationship between each of those variations, only because you're telling the database, I just need one of these terms as the criteria. That goes for each of these concepts. But when you're grouping those concepts together into one strategy, there will be an and relationship between each concept, because you want the database to set up a criteria that it has to at least have one of these things in addition to one of these things in addition to one of these things. So this is the final strategy, a sample strategy of what it would look like. Another thing I want to highlight is the use of wildcards. I didn't really go into that, but it's on that basic searching slide. If you want to include anything that has a plural version or a variation when it comes to the ending, you can use a wildcard to account for that. So I won't go into too much depth about how to use the next two resources, but I wanted to highlight some of the measures or instruments that are available to really assess the quality of research you're looking at. So this is specific to medical education research quality. The first one, the MRSCI, the Medical Education Research Study Quality Instrument, is probably the most frequently used. You can read here kind of what it's designed to measure. Another one that's often cited is the Newcastle Ottawa Scale Education. And if you wanted to take a look at appraising the quality of these instruments, there is a good article from 2015 in Academic Medicine that you can take a look at. There are also medical education reporting guidelines, which are different from medical education quality instruments. Reporting is merely giving you guidelines on how you should be reporting out your results. So it has nothing, it's connected to quality, but it's really focused on how you're actually writing up your results and your methods. And so there is a defined criteria to report innovations in education reporting guideline called Doctrine. And this is reporting specifically for educational innovations in curriculum development. There's also guidelines for reporting evidence-based practice educational interventions and teaching called GREET. And it's for any sort of reporting for educational interventions for evidence-based practice. So both of these hyperlinks take you to the Equator Network, which is a network in which you can pull the actual instrument to utilize when you're writing up your research. And then we'll move into literature management. So literature management comes in two flavors. One is managing search results and strategies. So when you are on the databases that you're searching through, there comes a time in which you find the citations that you really like and you want to move them over and keep them and retain them for use later. There are various ways and you can do that. Each controlled database does have some sort of clipboard or save function. PubMed, for example, has a clipboard of which you can navigate through the tools up at the top of the screen. They also have what's called My NCBI, which is another set of functions or tools that are available to you. That's free to register. It allows you to retain articles for a lifetime, as long as you don't delete them, unlike the clipboard, which only retains information for 8 hours. It also allows you to save search strategies that you've run previously and you want to continue update of those strategies. It can you can set up a tracking / notification system in which PubMed will send you an email with the new results. In addition to that, other ways to manage your search results would be to use a bibliographic citation manager such as EndNote, Mendeley, Zotero, Pages. It just depends on what you prefer and what your institution also supports. And then if you're undergoing a more rigorous type of research in which literature management is even more crucial and more nuanced, then you can use something like Covidence. Covidence is specific for evidence synthesis projects and systematic review projects, but that is also another way in which you can manage your literature. And then finally, you can keep track of new literature in various ways. You can follow social media tweets, for example. A lot of publishers tweet out any new issues that have been published, new articles of interest. There's also kind of the traditional email and table of contents alerts in which you can sign up via email for each publisher in getting, table of contents alerts and when new issues or articles are published. And then finally, there's apps such as Browsing, QXMD Read, and DocFin, in which you can save journals into a personal library, and you can check that app to see, what new articles have been published. A lot of people find it easier to go through an app like that so that they can get push notifications, for example, when something new has been published. Given that we're close to time, I just wanted to just briefly go over preprint publishing, or just the fact that there is a slide on the slide deck that talks about preprint publishing. If you are doing any sort of research, whether it be medical education related or not, if you're using content for preprint publishing servers, just make sure that there hasn't been a retraction for that publication so that you're including really, valid quality research within your library of citations. And this is just, if you're interested, these LibGuides or subject guides are available to you. The literature searching LibGuide touches upon some of the content that we discussed today. And the Meta LibGuide really looks at medical education resources and journals and books that are relevant to medical education, teaching and research. And this is my contact number. So if you have any questions about what I've presented today, or if you want to, tap my shoulder to get feedback on something, I'll be more than happy to answer any questions. And also always contact your local medical librarian within your health system or institution. They are like me, they're there to help you, and they can certainly give you, really informed guidance on any sort of research related tasks or steps. So I'm going to stop sharing my screen. Quick.
Wendy, thank you so very much. That was amazing, chock full of helpful information. I just want to highlight for any scholars, first year scholars, inaugural scholars, or current cohort scholars that are working on anything to do with curriculum, that MedEd portal and MedEd publish as databases that have already constructed curriculum, including all the pieces that we find really time consuming to build, the rubrics, the examples, those are all there and downloadable. I thought that was an especially helpful resource. So thank you for sharing that, Wendy. Maybe 1 minute questions, thoughts? Go ahead and just unmute, please.
I'm glad you recorded this because it's so much information. I would like to review it again. Thank you so much.
Yes, absolutely. And I'll be more than happy to share my slide deck if you're interested so that you can have it on hand for review for later. And I agree, it's a lot of information coming at you within an hour. So yeah, I'll be more than happy to share my presentation.
Thank you. This is Lisa Rick. I did my research when I did card cataloging, and I didn't have to go to the library, and you didn't include that at all. So we've come a long way from card cataloging, if anyone remembers that.
Yes, we definitely have. PubMed used to be, I was told PubMed used to be like binders of papers. So if you can imagine going through and finding articles by searching through binders, I mean, I can imagine how labor intensive that was.
Well, thank you very much.
Absolutely.
Just to let everybody know, we don't have MBase or EndNotes. We have RefWorks to use. And also, I'm really grateful for Sayori for speaking at the last minute because I wasn't able to.
Can you, Mary, can you say that those resources again or spell them?
Yeah, we do not have MBase or Scopus.
What do we have?
We have the other ones, and we have RefWorks instead of EndNote. So it's available on the intranet, and anybody can contact us for help.
Thank you, Mary. Thank you for being here to plug in, even though you're not feeling well. Really appreciate it. Great, folks. Well, we're actually at time. So I just want to thank again, Wendy, so much for being here. Thank you for a fantastic presentation. We will be posting slides for those who are scholars in our Teams channel. And we do also just want to give a quick plug for our next Lunch and Learn, which is a special Friday edition on November 18th. We will be very pleased to host Dr. Janet Corral, who's Associate Dean of Medical Education and Professor of Medicine at the University of Nevada, Reno, talking about all things technology, artificial intelligence, and virtual reality. So that'll be a great one. So thank you again, Wendy. Just welcome. You'll be a friend of the Academy forever. We're really grateful for you sharing your expertise with us today. Thank you again.
Absolutely. Thank you, everyone, for your time.
Thank you, Wendy.
Thank you.
Thanks.
Thank
Folks,
you.
I'll stick
Thank
around
you.
for a few minutes if there's any questions from scholars, if anyone needs to touch base about anything. And I'm going to stop the recording now. Thanks again.
That was great. I have to go, but thank you so much.